As a nonprofit healthcare organization, we rely on your generous donations to help us provide safe and reliable healthcare to our community. That's why we have a silent auction tonight. If you'd like to participate, please log on at 32auctions.com/ring2020. Welcome to the 2020 Ring of Champions. This has been a very unique year, and this event tonight is no exception. Generally, at our Ring of Champions event, we honor a community member or an employee of Signature Healthcare who's made an outstanding commitment to Signature and or to the community. Tonight we have the opportunity to recognize you, our many Signature Healthcare employees who have made such a significant difference during this COVID crisis. We thank you for your hard work and dedication to help those in our community who have been stricken by this disease. Additionally, it's an opportunity to thank the community members who stood up on our behalf and made generous donations of personal protective equipment, hand sanitizer, masks, gowns, gloves, and money to help us fight during this really difficult time. Thank you to all of you. We appreciate you. As a nonprofit healthcare organization, we rely on your generous donations to help us provide safe and reliable healthcare to our community. That's why we have a silent auction tonight. If you'd like to participate, please log on at 32auctions.com/ring2020. At this time, I'd like to introduce Sister Barbara Harrington, a member of our Pastoral Care team. She and her team have done an outstanding job during this pandemic, helping those employees and patients who were feeling the effects of the pandemic. Sister Barbara?
Breath of my breath, divine wilderness between the before and the now, gulped in, set free, predictable, except when you're not. On this precarious ridge lies love's firmest ground. Vulnerable, we lay our lives open to the promise of breaths yearning to be free, to flare forth, even as they are masked, healing, mourned, and celebrated. O divine mystery, we are so alive in this vast, evolving universe, sharing breath and honing skill with all beings wild and compassionate. Awaken us, even those of us fearful, breathless, to the dream of earth, a community of beings, whole and well. Leave no imagination dulled to the breadth of possibilities unfolding. And from our sacred depths as a Signature Healthcare community, may we learn unrushed to whistle for the love of seeing a breath some winter's day, frosty, healed, and shining in the sun. Amen.
At this time, it's my pleasure to introduce the leader of Signature Healthcare, our president and CEO, Mr. Kim Holland.
2019 was a really difficult year for us. We had just finished coming out of the worst financial year we had had in, I guess, 10 years. The government changed the way they paid us really dramatically. It was overnight. We had to respond. The team did an incredible job of responding to the financial difficulties. We enter 2020 thinking this is going to be an awesome year. We're going to establish a new electronic medical record for the medical group in the hospital and integrate the medical record. we're going to open up a new ambulatory surgery center and recruit a spine surgeon for the hospital so that we can take care of patients and keep them from having to go to Boston for spine surgery. We were going to finish negotiating with Beth Israel Lahey our agreement. It had been 7 years since we joined Beth Israel Lahey as our adult partner. We're looking forward to bringing in new specialists into the community. And we were riding the financial ship. We had changed our organization, become more efficient, and really leaving population health to growing our organization over time. We had the wonderful opportunity to take care of the Brockton Neighborhood Health Center's maternity patients, and we're seeing 50% more maternity patients than we had before, and everything was primed for an incredible return to normal growth as an organization. And then January happened, and we started hearing these incredible stories coming out of China and looking at the virus and what it might mean to us. And nobody, I think, could imagine the coronavirus and its impact on the organization. So January and February come along, and we have a couple of patients, and then there's the big spread event in Boston with an event they brought people to, and then I think it spread all over New England and probably had some spread coming from New York, and then all the international travelers that come into Boston. We enter March with just a few COVID patients, and then our world sort of dramatically changed from there. And 2019, 2020 disappeared in the rearview mirror really quickly. And looking back at the pandemic is how in the darkest days, when we are anxious and don't know what the future holds for us, sometimes in those dark days it's as if this big dark blanket comes over us and creates this void. And I've always found in my career working in hospitals, anytime you find a dark void, that's where angels appear.
It was a big challenge not being able to have the families there with their loved ones because at the end of the day, we were able to go home to our families regardless of the type of day or situation that we had. And it was a challenge to know that these family members couldn't come in to see their loved ones.
When he was in CCU and he was sedated, and I asked his male nurse, I believe his name was Tony, I asked him, do you talk to him when you go in there? Do you tell him what the day is? Do you, just fill him in on what the weather is? Anything. He's like, oh yeah, I talked to him. I said, will you let him know that his wife Pam told him today's going to be a good day?
Being that extension to be there with that patient and be able to connect with the family, via the iPad, those were rewarding moments because even though they couldn't physically be there, they were still there.
Those angels appeared in the stories I heard about nurses just taking time to hold the hands of patients. The stories I heard about nurses FaceTiming with family in the ICU when the patient had been weeks without being able to see their family. The stories I heard about staff helping each other don and doff. The stories I heard about support at home for each other. These angels appeared because of the better human nature of people. And crisis, I think, creates this void that allows angels to come out. And we just have so many angels in our organization that are worth celebrating.
She couldn't rely on me to tell her what was going on because I was out of it. They would tell her on the phone what to expect, what not to expect. And then again, she didn't know it, but at the time they were coming in and holding my hand. I didn't know it. When I woke up, it was just nice to have any kind of contact because I couldn't see my family. So the nurses and the staff were fantastic.
We recognized that employees were really struggling with the stress and anxiety of what did COVID-19 mean for them, for their families, their children, and even working here at the hospital.
We're all here for a reason, but particularly with COVID, when it hit, it was a brand new experience for all of us. We all thought we would never be in a position like this, and going through it was difficult to initially accept at first. It was scary. But, working together and knowing that we were all there for the same reason, helped us. Like, my experience was surreal. The reality hit, especially when our OR room was transformed into a COVID surge wing, and the reality of seeing everybody in there for the same reason, and knowing what we were dealing with, that's when it really hit. And then especially too, out and about in society and seeing things changed with social distancing and wearing masks wherever you were, the reality really hit there.
We had to make decisions at the spur of the moment. We didn't know what to expect or how to react, and we had to make decisions like every day, every minute, every hour, because we didn't know how to treat these patients at first or what to do.
All of a sudden, we were faced with these insurmountable problems with the patients, and we really didn't know what to do yet. We've, gotten better. We've had a little bit more research behind us, but it was scary. It was a challenge with my family, with me working with the COVID patients, because I do live in a multi-generational family household. It was a lot of being very careful about not wearing the things that I wear to work home, and making sure that I changed, clothes and changed sneakers and wiped everything down. And, I was very diligent about keeping the area clean, keeping my car clean, keeping everything.
When the COVID started, I work every day, 5 days a week. Sometimes I work 6 days a week. And then when I come into work, when I finish to work, when I go home, I don't sleep with the same bed my husband sleep. I protect myself, I protect my family, I protect my friend, my coworker, everybody, that they don't get the virus if I have it.
What was going through my head at the time, I guess, was being careful. We have families to go home to. We were rotating physicians in and out of there, so every day I had a different physician coming in to work with me to see the sick patients. It was more about getting the process down and tweaking it on a daily basis to, fit whatever need came through the door.
The most difficult challenge to overcome through all of this, I think, may not just be one, but a couple together, were one, figuring out what was happening and how do we do the work that we needed to do. So figuring out we needed to set up a testing site, to figure out that we needed to set up a respiratory clinic where we can see our patients safely. And then to deal with the anxieties that our staff, our MAs, our MOCs, the doctors, the nurses, the nurse practitioners had in seeing and caring for these people, and what was it going to be like in a world that we didn't know, both for our own personal safety and also clinically. We had no idea what we were dealing with.
I think that teamwork is the secret sauce for us getting through the pandemic with the best patient care possible and preventing our employees from becoming sick from COVID internally. And it's how they work together all across the system. You saw people accepting jobs they had never done before, being willing to go into COVID areas and go into the ICU, but they hadn't worked in the ICU before. They might have worked in the emergency room or another critical care area and cross-trained. We had physicians in the primary care practice go and train to support the hospitalist coming out of their primary care practice to do that, and they certainly didn't have to. We had employees that we would have furloughed that came back into the organization to take on jobs that weren't their traditional jobs. I heard stories of staff where nursing staff transferred patients initially to keep transportation from having to do it, because they were worried about transportation donning and doffing appropriately and make sure that they really understood how the disease spread. So they, out of concern for their fellow worker, really supported them through doing that. And so did radiology with the transportation staff, take on some duties until everybody was ready to handle patients. People just sort of got into the middle of any space and filled it as team members. That was really amazing, around the clock, that in the way that they work together to take care of patients and to keep each other safe, and including the teamwork around emotional support, both through the pandemic and after the pandemic. I heard great stories of people reading Bible verses, of staff coming together and doing meditation on nursing units to support each other through the emotional turmoil and pain of helping families and patients really work through COVID, because it was so difficult for them. I was just amazed with the amount of support that they gave each other.
Earlier this year, I started a prayer group. Mr. Holland had sent out an email to inform the staff of the ongoing pandemic, and he opened up that email with a scripture. So I felt that was a way for me to start a prayer group for anybody who wanted to join me.
Looking at how the staff, how the hospital, how the team responded was really just an amazing thing. It was nothing you could anticipate, no resources. You couldn't just pull the pandemic book off the shelf and read what to do.
We actually created a COVID unit, which is, we took the recovery room, which is an open space, and we decided that every COVID intubated patient will go there. Not every, the overflow from the ICU, so that we had at any time, anything between 5 to 10 patients over there, open unit. And we didn't have enough staff in the ICU to staff those beds. So we actually got nurses from endoscopy, nurses from the floors, nurses from the ER, and they were all volunteers. Like, we literally said, we need nurses to help us in the COVID unit. Which ones in this department want to help? And people raise their hands and say, yes, we're coming in. Nobody collapsed. Nobody said, I'm leaving. Nobody said, I can't do it anymore. Everybody held their own. They were so flexible. The flexibility was just very noticeable. And I don't know if it can be repeated again, or it can be repeated in any other institution.
The one thing we discovered is that the team really became a very different team. It was a hospital team. It was a community team. People moved from location to location wherever they were needed. Nurses from the outpatient arena moved to the inpatient. We had float nurses who became critical care nurses. We had operating room staff who screened visitors and people coming for appointments. Pediatrics became an adult area for patients who couldn't be discharged to the nursing home. So everybody's role changed, and everybody had to learn to adapt to that, and they certainly adapted well.
Having difficult conversations on the phone, staff was always there just to provide support, especially if they could overhear that it was a difficult conversation. I think the social work department supports each other all the time, and I think we all stepped up even more just to be able to be there for each other, especially when we were doing difficult phone calls with patients and families.
We split up as a team almost immediately to recognize that we had to provide all of our staff information about what COVID-19 meant, how could they deal with the stress and anxiety, and what could they do to help dispel some of those fears to their family members, including their children. We provided them with a number of different educational pieces of information, simple things like, how to make healthy meals on a budget, or even for their children, how to create a school at home. It was something that, when a child's homesick for the day, we know how to take care of them. But to school a child from home with a lesson plan while you're still trying to work was difficult. So we looked for resources to help them find that pathway.
During the pandemic and the surge, I think it was really dark times for the hospital. It was actually a very difficult time. We went into it not knowing what to expect because we had never been through it before. And then to see all the sick people come in and and we had a lot more bad outcomes than we wanted, but also not knowing what we were dealing with. We didn't know, at that time, we didn't know anything about the virus. We barely knew how it was transmitted, and then we didn't know how deadly it could be. And so overall, I think the organization did as well as it could in such a hard, difficult situation of not knowing. We had everybody pulling in the same direction. There was no me mentality. It was all us mentality, and we were making decisions minute by minute, hour by hour. And I think it got us through the pandemic as well as an organization could.
The teamwork from every department was amazing. In the critical care unit, we had nurses and physicians floating into a unit that they had never taken care of patients on. The CCU nurses had to be educators and train new nurses or nurses that were floating in on how to take care of critically ill patients.
I think working together too, that kind of helped us trying to stay sane through the whole thing, because we didn't know anything. So it was like we got thrown down there and we had to learn as everybody else was learning, and how to deal with the whole process. So I think definitely working together pushed us a little bit through it.
Yeah, and then it was like a new experience, because for us it was like the first pandemic in our lives. So we learned a lot, and then I really like challenge. So it was hard, but we got through it, and I think we can get through it.
I have to say I'm amazingly impressed by the cooperation and understanding of staff and coming together and working as a team to unify in the face of a tremendous unknown risk. Folks quickly organized, were adaptable, were understanding, and worked well above and beyond what they were required to do in order to get the job done. Staff worked overtime. We rearranged schedules, rearranged patients. It took a lot of effort to make that happen. So everyone from the providers, physicians, midwives, nurse practitioners, office support staff, secretaries, medical assistants, really unified as a team to get that coordinated job done as seamlessly as possible.
I'm really proud of how Signature stepped up. So many people gave so much of their time and their efforts, and even making sure that they were able to do large-scale COVID testing or still take care of our patients, or even the temperature screeners at the door. We all wanted to make sure that we were able to provide the best quality care possible, but still maintaining as much safety as possible.
To be a good critical care unit, we have to function as a team to begin with, but this was really done well, and it showed how well we do work together as a team during the COVID crisis, because people came from different units. People came that had never worked in the critical care unit, but they came to help us out, and so it was amazing. It was amazing to watch. It was amazing to be a part of. It gave me faith in humans.
I think the motivation was that for us to get together was to stay focused as a team, but most importantly realize that could be any one of us in that bed. In that situation, and we would want somebody to be there for us in our time of need. And being able to realize that and recognize that we're all there for that purpose was a standout moment, knowing that we ourselves could be there.
The unique thing about the teamwork was people came together, worked incredibly well together, were willing to do things that they had no idea, again, that they would how to do those things in the past, and were very creative in solutions. People just incredibly just stepped forward and did what needed to happen. It was, as I say, it wasn't uncommon for me to have tears in my eyes seeing people.
I think one of the silver moments of hope for me was probably the fire and police parade, just for a lot of different reasons. So we had been living through COVID, a high number of patients, staff had worked really hard, they'd been afraid, they were afraid for themselves and their family. Everyone across the organization had been working hard. They had heard from the community how much they appreciated their work, and you'd seen it on TV, and you had seen people on TV standing outside their houses and ringing bells and singing and doing all kinds of things to support. We'd received a lot of food. But just to see our employees come out of the building in all departments and come and watch this very visible appreciation of firemen and policemen who put their lives on the line every day, and respect for healthcare workers and what they were doing for their community was tremendous. And I walked around talking to the staff and just listening to them talk about how much they appreciated knowing the community was with them. The community appreciated what they were doing, made it possible, and they cried. It was just wonderful. And the hope for me was that our staff was going to get through this. I knew they were delivering incredible care. I never worried about the level of care they were going to get. I wanted to make sure the staff got through this emotionally, and that gave me hope. It gave me hope listening to staff talk about how much they knew they were appreciated by the community.
In seeing the community response to the surge and how the staff responded to everything in the hospital, I think just even seeing things in social media of how staff members put up videos of how they coped with everything, or even just community services that brought in food and everything for the staff, I think part of that was certainly uplifting for all the staff members, and especially the parade that we had with all the first responders and the fire trucks and police and ambulance going by. I think that day definitely stuck out to me. It just validates everything that you've done, and all your work that you did. So seeing that response and just the thankfulness from everyone, I think was a great day.
And the other thing I saw too was a lot of pride in the community. A lot of parents whose kids were working here at the hospital had so much to offer, not just for their own kids, but also for everybody else who was doing this with them.
Some patient will come in and then they'll say, "Oh, thank you so much for you guys to put your life in risk and to help us with testing to make sure if we have it or we don't have it." That was really, it felt good when the patient tell us that. Even some patient like, "Oh, I should go get a coffee for you guys," because it was cold at that time, like February, it was really cold outside. Just to have the patient to be thankful, that was enough for me.
I think in terms of response from the community, the outpouring of donations in the first week and the second week and the 8th week, they were never ending. And the messages and cards and the parade just spoke to the human connection, the strength, and absolutely what is possible.
I was so impressed to see the community step up. One of my patients dropped off an entire box of handmade cloth masks that she had made just for all the providers and the staff. So it was really nice to see really the community doing their part to pitch in.
My sister's a frontline worker. A couple people in my family got COVID pretty early on, and there was a shortage of masks, and there was all these people looking for them, and I know how to sew. And I was home, not working at my normal job, and I figured I could be of use in some way, so I just started sewing. I have friends that work for the hospital. I've been a patient at this hospital, and a lot of nurses from this hospital reached out to me looking for masks to be donated, so I just continued doing it. My limit was about 250 masks, like a day.
My husband's on the board of trustees at Signature Healthcare. My doctors are here. I'm not a nurse, I'm not a hospital worker, but we are very committed and dedicated to Signature Healthcare and all the staff here. And I knew that I had to do something. I couldn't sit back and know that PPE equipment was going to be scarce and that these nurses could be, doctors, frontline workers could be at risk without something to protect them. So I did. I started making masks, and I was getting called by friends and family of friends, and I began there. And then I said to my husband one day, I really think that I should consider making some for the hospital, find out if it's okay. And of course, right away, they were all thrilled to have masks, and there I began.
I was able to secure 1,000 face shields for the hospital. I was told that they were going to be shipped at some point, and then I got a call from Karen in purchasing that there was an 18-wheel truck outside looking to make a delivery, and so that was kind of cool.
My dad comes here, and all my family members are a part of Signature Healthcare. A big part of why we donated food was, I guess, we knew how hard people were working, and I compare it to like our Christmas time. I work like 80 to 90 hours in that like 1 week, and I feel like a lot of people were doing that, and it's being overworked and tired and stuff. It's nice for people to help take care of you too when you need to be taken care of.
When the whole pandemic happened, we were trying to find a way that we could help out the community. And I happened to be sitting having a cup of coffee one morning, and I was like, okay, one of the biggest issues they had was finding face shields. And this was before they even had a way of being able to procure large amounts of them. I'm a boater, and I'm also an outdoor guy. And so what I did was I went on to Fisher Scientific's website and saw what it was like what the sizes were to make a face shield. And then I called some friends of mine who were in the boating community and to see about getting some plastic from them. From there, I actually cut templates for face shields, and then I went to Home Depot and I bought the rubber insert for it. And then I called a drapery person in Hyde Park and bought the banding from them, and eventually came up with a prototype for it. Delivered a couple to the hospital. They liked it, wanted it in different sizes, and then we started making it a lot of them, and we were making them by hand. We were able to manufacture 500 face shields.
The community really came together when the hospital needed supplies, and we got a lot of things like gowns, masks, face shields, hand sanitizers, bleach, and anything else that the community thought we could use in this time. My role really was to coordinate all of that, to pick it up, and then get it forward, documented, so we could thank our supporters appropriately. It was great to be a part of that sense of community and feeling supported through this time. Our community were our heroes and are our heroes. They made us feel like we were in this together. And the supplies and the support from them came in handy, and I know that all of the employees at Signature Healthcare really appreciated what the community did for us.
I'm really excited about the support we received during the middle of the pandemic from the Yawkey Foundation, who took an opportunity to give us $1 million to name the building that houses the Brockton Hospital School of Nursing, the Yawkey Center. It means so much in a lot of different ways. One is nurses have been on the front line, and we have had a nursing school providing nursing care and nursing education since the late 1800s. We established that school so that we could take care of the community. The hospital knew in the late 1800s, you can't have a hospital without incredible nursing staff. And we've been providing that education for years. And it's been a school that's really helped our community. It is a way for someone to have a wonderful career in nursing. It won't ever be moved offshore to another country. We'll always have nursing. And people have entered our school that come from families that have never had an opportunity to go to college. And they have this incredible career in nursing doing so many different things. It's a great affirmation from Yawkey, what we've done to lift up our community as well as to provide nursing education. And having that happen during the pandemic, where nursing was so important in taking care of patients, is just a wonderful affirmation.
The Yawkey Foundation had been working with Brockton Hospital long before COVID began, and that was very fortuitous because we got to know this hospital deeply. We got to know the leadership, we got to know the programming that's here, and as COVID hit, our trustees worked very hard to make sure we could get help where it was needed the most, to the communities that need it. And we were so familiar with Brockton Hospital and understood how they would value every resource they got in the situation that it was very easy for our trustees to decide to step in and help Brockton Hospital. What was an extra special thing to be able to do is when they had their board meeting, it happened to be during National Nurses Week. And so to make this grant and to make it for the Yawkey Center here with the Brockton School of Nursing during Nursing Week, understanding the sacrifice and understanding the incredible bravery really of the nurses and the frontline workers, the trustees just were so happy to be able to honor nurses with this gift. Foundation, the trustees and the staff, we just want to thank everybody at Signature Healthcare. This has been an extraordinary time, an incredibly trying time, and yet everyone stepped up, and it doesn't take one person, or it isn't just a doctor, or it isn't just a nurse. It's everybody on a team, everybody that makes this hospital work, that really is providing care and helping so many who are suffering at this time. So we're grateful for everything you do every day. We're grateful for everything you do for the community every day. Thank you so much.
The staff at Signature responded incredibly well to the pandemic. Going into the pandemic, we didn't know exactly how it spread. We were worried about our staff. Our staff were worried about their own health. They're worried about the safety of our patients. And so there was this constant change of information coming from the government about what to do. And we had tremendous issues getting the number of supplies we need. So we entered this with not knowing enough about the disease, knowing we were supply resourced, impacted, not having enough, and needing to innovate. And we enter the pandemic with a long history of our employees' innovation. You know, we've implemented 6,000 to 8,000 suggestions a year after year after year. Our staff have stepped up and said, how can we improve our job? I think they took that level of common intervention and throughout our organization from the bottom up implemented tremendous amount of change, tremendous amount of innovations to keep themselves safe and to keep our patients safe. I was just amazed and impressed with the level of innovation that happened really without asking for decisions from senior leadership and management. They just did it every day, and if it didn't work, they changed it.
Everybody's role changed, and everybody had to learn to adapt to that, and they certainly adapted well. They also had to adapt to a lot of differences in the physical environment, needing to wear full PPE all the time, the difficulty and the loss of seeing facial expressions of patients, being able to read what people were thinking, and you had to really look into people's eyes to see. And a lot of times what we saw was fear from patients, and it became really just just an emotional experience for those of us who had to really live through it and work through those times and manage those patients.
I know my staff very well. I know our staff in the hospital very well. I've been here for a long time. I know they are flexible. I know they deal with different situations, and I know they're well-trained professionals, but I didn't expect that level of flexibility. People actually put their head down and continue to work and to deal with the patients.
The one innovation that stands out from the pandemic is actually something that's not tangible. I've never seen a group or in an organization or people work together like we did during the surge. It was incredible to see, and I'll give you some examples. Just as Barbie stated, the CRNAs and nurses who aren't trained in ICU going up to work in an ICU. We had primary care doctors who came in from the community to work as hospitalists. We had primary care physicians who worked to set up outpatient testing and outpatient clinics so that they could divert patients who didn't need to be hospitalized away so that the strain wouldn't be put on us as a hospital. And we met daily, hours on end, on the weekends, groups of people that we would rarely see each other on a normal day. but I was working with people on every unit, including environmental services. And that collaboration is something that I think was unique to come out of this pandemic.
The pandemic changed everything at Signature Medical Group and changed things so quickly. Within a matter of a few weeks in early April, we shut down all of our practices. We switched over to telehealth, and I think within 2 weeks we went from normal to 85–90% of all visits were occurring by telehealth.
Certainly COVID dramatically impacted my role. The best analogy I can give you in describing the change, it was very reminiscent of when I was on active duty in the Air Force during the first Persian Gulf War. We immediately changed from being a peacetime organization to being a wartime organization. And that's really similar to what we experienced when COVID hit, and we had to change our operations on the fly immediately.
I think one of the things we did that was really outstanding was the testing we set up for the community. And we had staff and providers from across the medical group just day after day spending their time helping test people in the community.
We had to definitely take a lot of precautions like gowning up and make sure that we had the correct mask and changing gowns all the time, and the distance, and then testing, and you had tried to stay the distance between you and the patient. So that was very hard.
I think the most difficult challenge during the pandemic was the challenges we faced at being able to provide the same level of care but not being able to necessarily see all of our patients in person. So telehealth was a very effective means to be able to still take care of them virtually, but we were having to be a little bit creative with how we saw our patients on video. Seeing patients through a video screen was also technically challenging for a number of our patients, especially when they were trying to use their computers or their smartphones to navigate certain things that we wanted to see, for example, a rash. So sometimes they would be pointing to their forehead, and I would have to tell them how to reorient their camera, and I would tell them, oh, I see the ceiling right now, or no, I'm looking at your refrigerator. So we'd have to sort of teach them. So we'd all had to kind of chip in, be kind of creative with how we helped our patients virtually.
Dr. Soror was very good with trying to make sure that we were covering things as information came out. Like we would do tents for the BiPAP patients to make sure that the virus wasn't being aerosolized, and so there was just, he was very much like reading and making sure that we did things to make sure that the patients were safe, that the employees were safe, and that we were taking precautions. And
my job changed a lot. I actually left family practice and was working at our son's clinic for COVID patients. Basically what we did over there was see sick patients, determine how sick were they, did they need to go to the hospital, were they manageable at home. So my job was completely different during the pandemic.
I think the outlook for 2021 is great. My glass is usually half full or more than half full. I'm hoping we're going to get through without a major surge in the winter, that we'll continue to take care of COVID patients, but it won't be what it was back in February or April. And that as we move through 2021, we'll be able to completely take advantage of the new spine surgeon that we've added, Dr. Gandhi. We'll add an ambulatory surgery center to our organization and take advantage of the incredible orthopedic surgery growth we've had over the years. And we'll return back to normal as an organization, taking care of these really sick patients who need our care in the Brockton area. I think we'll be fine in 2021, and we'll finally have a vaccine, I think, in 2021. And we'll be coming back to normal as an economy and as a society, hopefully by late summer or fall. I'm not sure we're ever going to get rid of wearing masks for probably 3 years every winter, but I think most of the organization will turn back to normal. I'm looking forward to 2021. thanks to the community for supporting us in so many ways, for feeding our staff day after day after day, for giving us N95s and masks and making masks and coming in, for showing your support through all the stories, through the letters, through the comments on email. Thanks you for the support. It made it easier for us to take care of you, and the relationship we have with the community is so much stronger coming through a pandemic together.
I just want to express my thanks to people from all over the Brockton area who came by and just dropped off supplies and gloves and masks, and we heard from dentists and veterinarians and people in construction, and this was occurring at a time when we didn't know that we would have enough supplies to care for our patients, and the community just stepped into action and helped us out when we needed it most. And so thank you very much.
Thank you so much for everything that you have done for us through this difficult time and continue to do for us. The outreach of the letters, the masks, the food have been vital to our success in treating these patients. We appreciate you and thank you for everything that you do for us.
We appreciate everything that was donated to us, from face shields to meals to hair protectors. I even received a prayer rock, and just the calls from family members in general, knowing that we were dealing with this pandemic and being a frontline worker, and we were the ones that were able to connect these patients with their family members, but the outpour from the community just being thankful was enough.
The community was outstanding with their donations.
For all our frontline workers, nurses, doctors, and all the staff here at Signature Healthcare, there really aren't enough words. You put your lives selflessly on the line to save lives, and for all those hands that you held as these patients were taking their last breath, I know there's families out there that are very grateful for what you did. For all those lives that you were able to applaud as they left the hospital, there are families that are grateful for what you did.
You should all be extremely proud of what you do every day, and know that your community appreciates those efforts.
These people took such good care of him. They were almost a part of our family at this point, because we relied on all our information from them. We didn't want him to leave the hospital, because he had received such good care, and I wasn't sure wherever he was going to go, he was going to receive that quality of care as well.
Tell you, I was thrilled because I wanted to go home so bad. It's one of those tough scenarios where you realize that you're going to miss these people, but you don't want to be there. But they helped you. They saved my life.
He came off intubation on Mother's Day. That was like the best Mother's Day gift.
Thank you so much for all the incredible work you've done to take care of this community. Thank you for your compassion. Thank you for your clinical expertise. Thank you for your teamwork. Thank you for coming back every day, day after day, putting yourself at risk, and I know putting your family at risk. You've done an incredible job.
So many departments, environmental services, housekeeping, dietary staff, people that are behind the scenes that we can't function without. We really recognize everything you did and can't thank you enough.
Thank you to family practice, from the receptionist to the doctors to the medical assistant, because when we were working as on the cots, we all had to be together to make appointments, to arrive patient. It was really good to pick up the phone and say, "Can you help me?" They will help. The help was there right away.
There's many people, some of whom we see every day, some of whom we don't, that make our lives possible. Whether it's housekeeping that keeps our rooms and our offices clean and tidy and reassuring to patients, to the people in dietary that provide meals to the hospital, and even to us when we're really, really busy. All those unknown people throughout the organization who don't get the credit perhaps that the providers and frontline people get, I'd like to tell you your work is also deeply appreciated and necessary, and enable those that are at the front line to continue to do their work tirelessly and all in efforts to provide the best in care to our community.
So I'd like to thank everybody in my team and the organization who stepped forward to take care of all of our patients. I think our patients were incredibly well taken care of in this incredibly trying time. And we all owe an incredible debt to the work and the creativity and your ability and willingness to do this very anxiety-provoking, challenging work at this time.
I really want to thank all of the employees at Signature Healthcare.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you. Thank you. Thank you.
Thank you.
Thank you so much. Thank you so much.
And I just want to tell them they are my heroes, and when I get sick, I can't ask for better nurses to take care of me or my family. Thank you.